Good morning, good afternoon, and good evening, depending on where you're joining us from the world. I'm Jonathan Edelheit, CEO of the Medical Tourism Association, and I appreciate everyone coming onto our webcast today, which is Opportunities in Medical Tourism and how the MTA can help. So this is a webcast where we're going to be covering a lot of different content, talking a little bit about, who the MTA is, talking about some of the different programs and services that we have, our certification programs, our upcoming conference, and some new and exciting updates, of projects or initiatives we're working in with buyers or other organizations. At any time, please feel free, to type in a question in the Q&A box, and I can answer them potentially as we go or towards the end of the presentation. So the MTA, we're, the Global Nonprofit Trade Association for the Medical Tourism Industry, for those of you who are new to us. We work with healthcare providers, governments, insurance companies, employers, buyers of healthcare all over the world. We work in almost 100 different countries now, maybe a little bit more, and we're all focused on raising consumer awareness of international options, quality, pricing, and outcomes, and helping consumers understand where they can go for care, but also working with the B2B side on business connections, best practices, standards, training, certification, brand development, and developing sustainable medical tourism programs. And this is an example of some of our health and wellness destination guides, which we use for consumers and also for buyers. So we've done them for Las Vegas, Jordan, Miami, Taiwan, and we have a couple others in the works. So as I mentioned before, we're focused heavily on three tenets, which is transparency and quality, pricing, and communication and education. So we've got a lot of slides to cover this morning, so I'm going to, fly through some of them, and the webcast and the PowerPoint will be available afterwards. So if you just email in, we can provide them to you. We do a lot of education in different magazines. We work with hundreds of media sources during the year, probably not hundreds, probably thousands, making sure the media around the world is covering medical tourism, covering it in a positive light if there's negative issues that are going on, making sure there's another side to the story, such as the Al Jazeera stories that have come out recently on a medical tourism facilitator, is balancing that out and showing the media that if there are bad outcomes or bad players in the industry, there are quality ones that you can work with, and it's all about who you partner with. We work in educating insurance companies, self-funded employers, travel agents, governments, all in implementing medical tourism. And I'm going to jump into a couple of quick slides on U.S. insurance. I know that's a huge growth opportunity in medical tourism. So, when we look at buyers around the world, if you look in different regions, whether it's, Africa, Russia, CIS countries, you have a lot that they either could be covered by the government or private insurance or they're cash paying. The U.S. is really different in that most people are covered by insurance, and it's either fully insured or self-funded. And I'm going to go into self-funded for a couple minutes, but what's interesting about self-funding is taking off around the world. So when I go over self-funding for the U.S. market, this is going to be a big emerging trend globally also. So it's good to really know about it. So fully insured plans are when you go with an insurance company, if you guys are familiar with Blue Cross, Aetna, Cigna, where you pay a set premium each month and you get your health insurance. For your employees, or you're paying for it individually. So you have no risk. You're paying $500 a month as an individual for your health insurance, and it covers everything. Then you have self-funded plans. And with self-funded plans in the U.S., this is where employers pay their own expenses for their health insurance. So they pay their own medical claims, they handle the customer service, and they usually bring in some organizations like a TPA to act like the insurance company. What most people don't realize is how big self-funding is in the U.S. So if you look at this chart, 93% back in 2010, and it increases by about 5% to 7% each year. Employers with over 5,000 employees, 93% are self-funded. So that means the majority of large employers self-fund their benefits. They're not fully insured. And then if you look at those stats, 1,000 or more employees, it's 80%. 200 or more, it's 58%. So the majority are self-funded. When you get to the smaller groups of 3 to 199 employees, you'll see that it's 16%. For very small groups, not as big, but it's still growing. We've actually seen a trend recently in the health insurance where you're starting to see self-funded groups in the U.S. go down to as little as 10 lives, where that never happened before, 10 employees. So it's really growing quite significantly. And some of the benefits between self-funded and fully insured is if you're fully insured, you have to provide certain benefits under the Affordable Care Act. You also have to pay, you got profits of the insurance company, certain taxes that you have to pay, pooling charges. So if you can go self-funded, there's a lot of different ways that you can save money, and the cost might be a little bit less. And when employers are self-funded, no matter where they are in the world, they actually can save money. So what happens is if you're paying Blue Cross Blue Shield $1.5 million in premium for each year, and your medical claims are $1 million, that means Blue Cross Blue Shield is keeping $500,000, $500,000 a year in profit. If you're self-funded, that $500,000 goes into your pocket as an employer. So any way in which you can save money, you're going to want to save money and implement it. And obviously, the Affordable Care Act doesn't reduce costs here in the U.S. It only increases costs. It doesn't do anything to lower them. So you're seeing a continued trend of more and more employers going self-funding. And when you go self-funded, you have to look at what are the ways that you're going to be able to lower costs. Because starting January 1st of this coming year, the fines come into play for the employer mandates. So if you're over a certain number of employees and you don't offer health insurance, you have to pay a $2,000 fine per employee. So if you got 10,000 employees, it's $20 million. So if you decide then you don't want to pay the $20 million fine and you want to offer health insurance, then you need to look at what can I put in my plan that's really going to reduce costs. If you look, high deductible plans don't work, consumer-driven plans haven't worked to lower costs. So medical tourism is one of the only options where it's not theoretical, it's practical, it's reality, and if you implement it and people travel, you save right away. So we've been focusing on educating self-funded employers both here in the U.S. and abroad about medical tourism. And then you have to also realize there are multinational employers who are self-funded. So it could be a UK company, it could be a US company. And so that US company has operations all over the world, and they're self-funded. So that means that no matter where their employees are, you know, they need to focus on getting them the quality care and directing them to the right hospital. So jumping in from the self-funded marketplace, I'm going to be doing some case studies later in the PowerPoint, going through a couple U.S. employers who were self-funded who've implemented medical tourism. So benefits of certification. You know, we have different certifications at the MTA, whether it's for individuals or hospitals. It's all about increasing quality, streamlining the process, putting best standards and practices in place, and creating confidence and trust and credibility in the industry. So we've developed these certifications, you know, over the past, you know, we started working on them as early as 2007 with industry experts and professionals in the industry. And I think it's really important, these standards and certifications. The Al Jazeera story I was mentioning before is even, you know, a bigger reason. And if you haven't seen that, Google Al Jazeera and medical tourism. If we don't put standards in place, and if there's not an, you know, a standard certification, then you're going to continue to have issues and problems like you've seen Al Jazeera, and that's going to hurt everyone in the industry. If you have a facilitator who's stealing money from patients or committing fraud with patients, that's going to make patients that are working for your hospital or your facilitation company even more nervous. about working with you. And so as an industry, we got to come together and say, enough, we got to stop, and we got to say we're only going to work with the best players going forward. And how do those best players separate themselves and make sure that people know that they have the highest level of standards and best practices. And certification also helps reduce an organization's risk and liability and the likelihood of errors, and increases potential positive outcomes, increase a competitive edge. So here's the certifications that we have. So we have International Patient Services Certification for hospitals and clinics. And I'm not going to be able to go into all these in depth. But this is a certification and training program just for hospitals to put in the right best practices, the right standards, and the right protocols for dealing with international patients. And the reality is that I would say there are two types of hospitals, really three types. There are hospitals that have bad service and protocols and standards in place, and it's not on purpose. They don't have a system in place. They've tried to build their program, from the ground up without any advice, guidance, or anyone from the outside putting in any protocols or standards. Then you've got hospitals that they think they're doing it well and they're doing a really good job, but they don't realize they're missing a lot of different standards and best practices and touch points, which result in better outcomes and amazing patient experiences. And then you have the third side of it, which is hospitals that they really do an amazing job at medical tourism 110% of the time. And the reality is there's a small portion that hit it and nail it every single time. Because if you're just missing specific protocols or standards, that can affect the patient outcome, that can affect their success, that can affect them with their word-of-mouth testimonials, and telling other patients, why they should travel. And then we all also know that, almost every hospital in the world doesn't even have a patient management system to manage their medical tourism program. So they're using Microsoft Outlook, Microsoft Excel, and Pad and Pen, violating privacy laws around the world. And also there's no way you can't have consistent great experiences when you're managing your international program through Microsoft Excel and Word. Things are going to get lost. And we've seen some really bad situations where little things like patients get lost because of that. So, and also I think one thing that's important is, there needs to be consistent training throughout the organization. And what I mean by consistent training throughout the organization is that it's not just the international patient department that's trained. It's also the doctors that are involved in medical tourism, the nurses, the anesthesiologists, everyone who is going to actually touch a patient. And I think that is so important, because if you only say I'm going to train one or two people who are in this international patient department and no one else, you're never going to have everyone buy into the program, and you're never going to have specialized and I would say a higher level of service or understanding how you need to treat a patient differently if they're from another country. So it's very important to get the whole organization and change the corporate culture within the actual hospital. And then we have the CIPS program, Certified International Patient Specialists, for the individuals working within the hospital. We have CMTP, Certified Medical Tourism Professional, which is for facilitators. And then we have Medical Tourism Marketing Professional, which is for those who are in the marketing of medical tourism. And then we have some other certifications we'll be launching shortly. We also do, for the MTA, depending on where you are in the world, we'll do workshops and seminars, whether it's for the government, healthcare clusters, the hospitals, insurance companies, and we look for local partners. So, depending on where you are in the world or what city you're in, there's a lot of opportunities to partner with us and develop initiatives in your city or country which can really help them move forward. And that's what we really love, is building long-term relationships. And we also launched our MTA chapter system, where we're rolling out chapters of the Medical Tourism Association in different cities or countries around the world. and putting in sustainable initiatives and programs so that chapter can really financially sustain itself and focus on the issues in that local city or country. So, the trainings that we do that I mentioned before can either be done in person or they're done online through our online learning management system. We also have MTA membership, which I'm sure many of you are aware of, and I, definitely, invite you to become a member if you're not a member. We have a huge initiative on the industry working with MTA members, which I'll share in a minute. But we also rolled out some new benefits, which we kind of call it game changers. So we totally revamped and changed our membership benefits this year. And, some of those things that are really unique that you'll see in here is on the slide is now patient leads, guaranteed patient leads during the year, where depending on your level, you can get up to 500 or more patient leads during the year, and buyer leads, up to 200 or more buyer leads during the year, as well as all the other benefits that we have, such as discounts on certification, 2-for-1 registration at the conference, complimentary ads in our magazine. So we have a lot of benefits that you really pay for themselves over a short period of time. And I think the patient and buyer leads are going to be great. And then depending upon your level, you also can get access to the global patient management system. So I won't run through all the benefits. Going forward, we have really developed some amazing buyer relationships over the past, almost 7 years. And our database has really expanded significantly over the past 2 years, and literally over the past year, it's really taken off along with some of our partnerships. So we reach almost 1 million healthcare, insurance, and HR professionals globally. On LinkedIn alone, we reach now about 500,000 HR, insurance, and healthcare professionals and travel professionals. So 500,000, 500,000 in about 30 different groups, and it's doubling each year. So by next year, it's going to be about 1 million. And we're getting thousands joining each week into our groups. And so what we're going to be doing going forward is we're going to be pushing out to all these groups a lot of content and education on medical tourism and implementing it, for the buyers and making them understand, you need to work with MTA members. They're the ones supporting best practices, supporting standards, moving the industry forward. This is the seal. If you, only work with those companies that have the MTA seal on their website and on their business card. And we're going to be announcing at our conference this year, which is September 20th to the 24th, some really big, exciting partnerships that is really going to, I think, significantly increase the number of patients traveling for medical tourism, and also the number of buyers in the industry and the access we'll have to educate buyers and promote our members. So we have really, I would say, potentially 3 to 4 extremely large partnerships and initiatives that we'll be launching and really announcing at our conference, and where people will see we're not just announcing them, but the fruition of that is actually happening at the conference. And we can always refer you to MTA members if you'd like, that can, provide you some testimonials about the value of becoming an MTA member. I'm skimming through a couple of these slides rather than sharing them with you. Because I think you can have these available to you later. And if any of you want specific information on membership or what are those specific benefits, or even talking offline about some of these partnerships we'll be launching, please let us know, because I think there's a lot of opportunity for us to help identify partners for your organizations that can really help take your business to the next level also. So jumping on to the upcoming conference that we're having, which is the 7th World Medical Tourism Global Healthcare Congress in Washington, D.C., September 20th to 24th. I hope all of you can attend. It is really, a great event. It's really the only one in the world, the only true global event. Last year we had over 2,200 attendees, and we're shooting for anywhere from 2,500 to 3,000 this year. And it's really a platform to connect with buyers, with hospitals, with facilitators from all over the world. We're going to have over 100 expert speakers. We have a lot of summits and industry forums that, are private, invite only. And if you go onto our website under Executive Summits, you can view them and request to be in them and participate in them, and they always fill up. So I definitely suggest that you do it, and I'll be going into the summits in a couple minutes, but this is where a lot of business and networking happens behind the scenes at the conference. So, what's the purpose of the conference? Really, networking meetings, listening to some of our international and top national speakers, and then obviously buyer and patient leads. And one thing you'll see here that we rolled out this year was guaranteed networking meetings at the conference and leads during the year, patient and buyer leads. So depending upon your level of sponsorship, you get a certain number of patient leads and a certain number of guaranteed networking meetings. And this all ties into us really doing some game-changing activities where we realize we're getting thousands of patient leads in per year through the #1 portal that we run, medicaltourism.com, and we're getting buyer leads all the time that are coming to the MTA or coming under our webcast or downloading our white papers. And with that, realizing that we should be giving this back to our members and our sponsors who are supporting our organizations. We rolled out earlier this year those initiatives. So rolling through this, I won't really go into the registration and costs for the conference. So let's go into integration of our conference. So one of the exciting things is some of the integration we have and some of the buyers that we bring into our annual conference. So, you might not realize it unless you go or you really delve into the events or the website. So we have the 5th Global Benefits Association Conference. So this brings in multinational employers and multinational insurance companies from all around the world speaking on global benefits. And there's a big trend right now where global insurance companies are implementing medical tourism. They're doing it in a very big way. One of the big insurance companies actually hosts a summit, their own conference within our global conference on the specific Center of Excellence medical tourism concept. And so all the global insurers are adding policies that allow people to travel for medical tourism. We also have the Employer Healthcare and Benefits Congress, which is the biggest U.S. insurance conference for employers and insurance companies and insurance agents. And that's made up of actually almost 7 tracks. So it's got the main ones, the Self-Funding Employer Conference, bringing in self-funded employers, the Corporate Wellness Conference, Voluntary Benefits Conference, and the National Healthcare Reform Conference. And this brings in all the top national leaders, big U.S. employers, big U.S. insurance companies, and even the administration. So it's integrated within the World Medical Tourism and Global Healthcare Congress. So you can actually schedule networking meetings with all the U.S. buyers that are there and all the global insurance buyers also. So here are some of the summits, and let me see if we go into the description. So we put on the Ministerial Summit. So we're bringing in ministers of health from all over the world. We have the Global Medical Network Summit, which is bringing in the key people responsible for contracting with hospitals from all the big international insurance companies. We have the 3rd Medical Director Summit, which brings in medical directors from hospitals and insurance companies. We have the Medical Tourism Research Summit. We have the Wellness Tourism Summit, so all the growing industry of wellness. There's its own event this year. We have the European Summit on Medical Tourism, the Women's Healthcare and Insurance Leadership Summit, which, if any of you are women, I definitely recommend for you to come. It got really great reviews. It's all about leadership and taking your career to the next level and how do you do it. And we get really inspirational women leaders, both global and national, to talk about, their careers and how they succeeded, and it's really great for networking. The HR Development and Leadership Summit, the Benefits Consultant Summit, the Employer Direct Contracting Summit, and they're not all here because there's even more. There's a Facilitator Summit where facilitators can connect with each other. There's Emerging Markets Summits, so there's a lot of, I think there's like 15 or 20 summits that you go and sit around a table with anywhere from 20 to 40 people. So last year, one example, we had our Facilitator Summit with almost 40 facilitators sitting around a table talking about the issues as a whole facing them as facilitators and how they can work together going forward. So the Buyers Pavilion in the exhibit hall, so we have a Buyers Pavilion in the exhibit hall. It's a really interactive exhibit hall. You can see the display online, so you can come and network and connect with different hospitals. but we also have interactive activities going on within the exhibit hall. And also, if you are on the call and you are a buyer, you send patients overseas, please either fill out our buyer VIP app to become a potential hosted buyer and get a free pass, or just email me directly and I'll connect you with the right person, here in our organization. So obviously, what's in it if you're on this call for healthcare providers to attend the event. You're obviously going to be able to attract patients and build a brand in international healthcare. You're going to be able to meet insurance companies and other buyers of healthcare. You're going to be able to learn strategies to implement from a marketing standpoint. I think the marketing side is really, really important. What is your conversion rate? There's a lot of things that hospitals or facilitators, they're missing out on, and you don't even know you're missing out on it. And what I mean by that, it could be what's the content on your website, what's the content on your brochure, how are you communicating to patients, and then it's how are you communicating to patients based upon their demographic, their culture, where they're from. All of them require a totally different approach. What's your conversion rate? I think many of you would be surprised to know there are clinics or hospitals out there that some have a very tiny conversion rate, a couple percentage points, and then there's some that have a 30% conversion rate. How are you getting the 30% conversion rate? So you can never improve your business unless you actually are able to go out and find out what others are doing, learning successful case studies, and how they're actually making it happen. So I'm going to skip through a bunch of these slides. Some of these the internal team member created, and I'm not going to sell you on the top 10 reasons to attend a trade show or anything like that they put in here. Because the reality is, I go to trade shows all the time. I go to the most important ones in my industry, and the whole reason I go is you cannot build your business through email and telephone. The only way to build your business is through building personal relationships in business, and that's face-to-face time connecting with people. And the way that I do that is by going to conferences or doing workshops or traveling to other countries to meet people. And the reality is there's a big segment of this industry that feels they're going to send a pretty brochure, they're going to email someone, they're going to call them on the phone, and it's simply not going to work. And there's more hospitals, facilitators, and others getting into this industry. So that means more people sending people their pretty brochures and links to their website and saying we have the best prices and quality, or we'll pay you more commission. And even that will pay you more commission via email. If you haven't met the people, you're going to start seeing there's certain types of buyers that's going to turn off, and they're not going to want to do business with you because they're more concerned with the quality. If you're dealing with insurance companies or employers, they're not concerned with commission. They're not even concerned with having the lowest price. They just want an affordable price, the best quality, and a place that their employee is going to be comfortable traveling to. That's what the employers want. So you really need to understand what they want, because otherwise you're going to totally miscommunicate to everyone. And obviously another reason why I'm a big advocate of, going to a conference like such as ours is simply the fact that in 2 to 3 days you can accomplish what would take you 2 to 3 years to do in your business. Because really, when is the next time people from all 90 different countries are going to be there for you to connect with the hospitals, the facilitators, the buyers? And I know for facilitators, there's a lot of hospitals that want business from facilitators, but they don't realize it's very difficult for facilitators to connect with hospitals. Sometimes they email them and the hospital never responds. The hospital doesn't know they didn't get the email, or they try to call and they can't get a hold of the right person, and they give up. And so for facilitators, it's really important that, they know they want to come to the conference so they can connect with the hospitals and actually contract with them. And for employers, it's, you're only going to get employer and insurance business if they meet you. And what we've also seen is we've seen a lot of business be transitioned or moved in this industry. So, I think a great example of that would be, some of the Indian hospitals. So India in the beginning, back in the late 2000s, mid-2000s, they were getting a lot of the medical tourism business. But then they basically said, hey, we're getting all the business. We don't need to market ourselves anymore. We don't need to be in front of people. So they stopped. And then you started seeing business moving to other countries. And in reality, from the U.S. market, you saw where India was going to be one of the biggest markets for the U.S. market, a total shift in that area. And now a lot of it is going to Latin America, or, and we're starting to see a trend also of it potentially going to Europe. And it's because those are the hospitals and the facilitators that are in front of the buyers. Medical tourism, it's growing really fast. And when it grows really fast, what it means is you have new buyers entering the industry every day. So if there's new buyers entering the industry every day and you don't have a presence with them, you're not actually out meeting them, they do not know you exist. So some hospitals, will get arrogant and they'll say, I'm the best hospital in Mexico City, or I'm the best hospital in Singapore. I don't need to promote myself, because when a buyer of healthcare looks to implement medical tourism, they're going to know Singapore is a top destination or Mexico City is. Then they're going to research it. They're going to find out my hospital is the best, and they're going to send me patients. And the reality is it's the biggest fallacy. It's totally not true. They're going to go find the hospital that they meet, they build a relationship with, and they will send patients to them. And I've seen it happen, even if that hospital isn't accredited. If they like the doctor, if they like the hospital, and they like the international patient department, they will send them patients. So those personal relationships are so important. And another example of that to share is there was, one of our past conferences, there was a facilitator who we helped connect with a meeting to one of our hospital members who had been exhibiting for years since our conference started. That year, from that one meeting, that facilitator sent 500 patients to the hospital for a specific procedure that was a little bit over $10,000. So $5 billion in medical tourism business. What did the medical director of that hospital do towards the end of that year? What they did is they said internally, we made it. We're a super success in medical tourism. We increased our business by $5 million with just one facilitator. We don't need to invest in training within our international patient department. We don't need to invest in marketing. We're not doing anything else anymore. Everyone's going to start coming to us. What happened? Those patient volumes started to decrease, and now the hospital is struggling a little because they stopped marketing. They stopped putting a face on themselves. It might not be the most politically correct thing to say, but they got lazy because you need to always build relationships and be in front of people. Okay, so this is cost benefits to employers and insurance companies. I was going over this before, and it's so important for you guys, for everyone to realize this. It's with cash-paying consumers, it can be about price. With employers and insurance companies, you don't need to be the cheapest. You need to offer a great plan that's affordable and has really high quality and deals with customer service and aftercare. That's what they want. If an employer can save $20,000 versus $30,000 on a procedure, it doesn't matter to them. They just want to make sure patients are traveling. And then on the right side of the slide, I think are some really great stats, which are really important. And that is that, for example, males are more likely to travel than females, but we know females are the decision makers when it comes to medical tourism. That if we look at just in the U.S. market, because there haven't been a lot of surveys globally, but you have, for Caucasians, white Americans, about 38% that would be willing to travel overseas for medical tourism. But when you look at Asian Americans, you're at 56.8%. And when you look at Hispanic, you're at 51.4%. So a huge area that everyone is missing in medical tourism, that is, multicultural individuals, and going after those specific groups that don't have an issue with quality in another country, language barrier or cultural barrier, because they're either from that country or they're descendants of it. So how are the employers and insurance companies incentivizing employees? They're incentivizing them through bonuses, waiving out-of-pocket expenses, co-pays, co-insurance, deductibles, paying for travel for a patient and a loved one, and in some cases giving them a cash incentive. So I'm not sure if you guys had seen last year the HSM story, and it was a story that the MTA put together with Diane Sawyer at Nightline and ABC News, and it was with HSM, a member of the MTA, with a hospital in Costa Rica, Clínica Bíblica, who's a member of the MTA, and how they're a self-funded employer in the U.S. For the past 5 years, they sent 250 employees overseas for medical tourism to India and Costa Rica, and they saved $10 million. Really great story, very powerful, and also shares the experience of the employees who went overseas, how they loved it, and how they incentivized them. And I think this is a great case study because it's not saying it's a one-off or, hey, this is something an employer tested and they had 1 or 2 results. 250 results positive over 5 years. That's huge. And now the whole culture of the company has changed. And now, people prefer to travel overseas for care. So that's really important. And in that case, for example, if we look at that specific case study, a knee replacement in the U.S. costing them almost $60,000, it cost almost $24,000 in Costa Rica. And then they had, so they sent someone for the knee replacement, and then they had someone with a gastric sleeve surgery where it would have cost $30,000, and it cost almost $17,000 in Costa Rica. So they saved almost $50,000 on the procedure, and the employees got a bonus check of $2,500 plus making sure they didn't pay anything out of pocket. So this is going to be this example of what's happening here in the U.S. with self-funded. It's going to be the same example that happens with self-funded employers all over the world, and these are conversations that you can be having with them. And then also we have the recent story that we also worked on that just came out last week that I hope you all saw on CBS News, and it was about Blue Light Casino and them sending one of their employees to France for surgery. And so there's a whole video on it, and rather than me talk about it, it's really much better for you to watch it. So it's a really great story. If you send me an email, I'll send you a link to it. And then also, if we look at, another example, there's also domestic medical tourism that's taking off. And that is employers, it's starting here in the U.S., but you're going to see it everywhere in the world, employers starting sending employees within their own country, but to centers of excellence, and saying, I don't want my employees to get care at local hospitals anymore that don't have the best care and great outcomes and transparent pricing with bundled package pricing. So, like for example, Lowe's, the department store, contracted with Cleveland Clinic for Heart Procedures. Pepsi partnered with Johns Hopkins, and a lot of others have done it. Walmart, Boeing. It's a really big trend, and it's going to be something happening all over the world too. And it's an opportunity wherever you are in the world, in your country, to actually go ahead and partner with employers in your country specifically to refer patients to those facilities. Our industry, in kind of summing up, the presentation, what we're seeing is a big trend of where medical tourism has been adopted all over the world. We just had our Asia Medical Tourism Conference in Taiwan, and we brought in buyers from all over Asia, from Indonesia, from China, from Hong Kong, from Korea, and basically, people are traveling where they can get the best care. And there is emerging middle and upper classes in every developing country in the world. And those middle and upper classes are demanding a global insurance benefit that allows them to travel for health care. And so what you're seeing is all the big global insurance companies now offering that as an option where you can buy up into a plan where you can travel anywhere. And then all these emerging insurance companies are also doing it. So if we look, for example, in the Caribbean, you have a lot of, whether it's through the government or through the local insurance companies, if there are very complex cases, you'll see them sending patients, here to the U.S. It could be to Miami. If it's up in Bermuda, you'll see people going to Boston. So a lot of people from the Caribbean going to the U.S., and you have a lot of investment in the Caribbean in building hospitals. You've got the big Dr. Shetty project in the Cayman Islands. There's a lot of investment going there. But you're going to see more and more of these policies. But the interesting part about it, too, is the global insurance companies are also trying to steer people So there's a lot of global insurers, for example, where if they're covering people in the Caribbean, they want to start steering them away from the U.S. They want to start trying to get them into either other Caribbean islands that have specialty care, or Central or Latin America, because of the high price in the U.S. So what the trend is happening with global insurance companies now is they're going to hospitals and they're saying, you need to transform yourself. Here are the requirements that we need you to put in place in order for us to send you patients. And that requires you to have transparent pricing, bundled pricing, where we know this is our price, all in. We don't have to pay anything extra. You need to have a multidisciplinary approach to care. You need to actually put in better practices to make your hospital more profitable and run it more efficiently. So this is very fascinating. The insurance company telling the hospital you need to run more efficiently, be more profitable, and have better strategy and management, and that they're actually willing to help them. And the reason why the insurance companies are doing this is they realize if they don't, the costs will continue to increase. And then what the insurance companies are saying is, if you can accomplish everything that we are requiring, in the future, we'll designate you a center of excellence and we'll send you patients. We'll steer patients to your hospital. So this is the future. 3 to 5 years from now, you'll see a totally different marketplace, because right now, patients are really determining where they want to go on their own. And now the insurance companies are going to say, no, you need to go to this facility, because they have better outcomes, set pricing, and they're working with us. So there's going to be a very big disruption of steerage of patients, but then also you have all these new insurance policies allowing people to travel wherever they want for care. I know in Indonesia, for example, you have a lot, Indonesians go to Singapore typically, but you're going to have, as more of those insurance policies come into play in Indonesia, because it's a little bit of a chaotic market, you'll see people willing to travel to other countries as other hospitals and insurance companies actually go after that marketplace. And I think, for example, like Carol, who's on the webcast specifically from the Caribbean, I think there's a really neat opportunity right now going on in healthcare and insurance, because healthcare costs they're no longer sustainable, and they keep increasing. And so whether it's the Ministry of Health and the government, or whether it's an insurance company, they all need to contain their costs. Everybody's racing and looking for solutions. And it's a real challenge, because what's being done that's innovative in insurance or healthcare? There's not much that's being innovative and nothing being done to reduce the cost. So if you can bring innovative solutions about new hospitals or clinics or new procedures, that could have a very strong impact on lowering the cost of care, you can pick up these insurance contracts with big insurance companies. And we're, for example, as an organization, we have something I think is a real game changer for Caribbean governments and insurance companies that we're going to be, announcing and rolling out probably at our upcoming conference, which I'm Carol, if you want to contact me, I'm fine with sharing with you. So, really with that, that kind of really sums up our webcast for today. I know we're kind of limited on time. It's been about 50 minutes. But I really recommend and would appreciate anyone reaching out to us, because we have a lot of different programs and services. We didn't even go in place creating strategies and roadmaps for hospitals, for facilitators, for governments. We have, if you're a facilitator, our membership team that deals with facilitators has built some amazing resources and tools for medical tourism facilitators and kits, things to help you convert patients, contracts that you can sign with hospitals, patients, employers. So we built a lot of tools and resources for the industry, and one of the things that we're really focusing on going forward is creating very strong partnerships in each country with local representatives, with a long-term goal of creating a chapter and looking how we can really build out a sustainable initiative going forward from there. With that, if anyone has any questions, you can reach out to me and send me an email. It's jon@medicaltourismassociation.com, or you can call us at 561-791-2000. Now, for those of you, I was right here going to click for the movie. I was told it would work. Maybe my IT guy can get it to work for me. But I was going to leave you guys on the positive note of playing one of the videos from one of the news story coverage But since it's not working, if you just want to reach out, we'll send you an email with that. Or please call us, and I hope to see some of you in the next couple weeks in Washington, D.C. One of the reasons also we moved the event to Washington, D.C. is because we are going to get a lot more government participation. It's kind of a hub for international governments, ministries of health. It's also a big hub for big national and international trade associations. And large employer groups. So it's really where most of the business and all the politics got done. So for us, it was really important for us to put it there. So as I said, the webcast and PowerPoint will be available. And what I'm going to do is hope that I'm going to cut off right now and that my IT guy is going to start playing the video.
Well, here's a story on Bastille Day. Imagine a 3-week vacation in France. Great restaurants, a chauffeur, the Eiffel Tower. And you don't pay a dime. In fact, you come home with more money in your pocket. Andrea Borba on the new healthcare trend that sent one Northern California guy packing.
Along the Pacific Coast in Humboldt County, you'll find the Blue Lake Casino Hotel. Owned by the Blue Lake Rancheria tribe, folks come here to gamble. But for tribal employee Bruce Ryan, he took a chance that paid off big. The construction manager needed surgery for a debilitating rotator cuff injury. He could have gone to Stanford Medical Center, but...
No, we went to France, to Toulouse, France, and did it. It was great.
That's right. His surgical odyssey began right here at the international terminal at SFO. The Rancheria's healthcare plan gives employees the option to travel abroad for treatment. Why?
We do have high quality care, but then also at the same time we also have the most expensive care in the world.
Jack Norshin runs the health plan and is seeing the cost of health care skyrocket for his employees. To keep costs down, he added the medical travel option.
Well, you have to look for creative approaches.
The plan provided Ryan with 2 round-trip tickets to France, as well as a chauffeured car and a translator.
You should come to France.
And a medical facilitator, France Surgery's Karine Hilaire.
We never leave our patient alone.
It paid for a top surgeon at an approved private clinic, a physical therapist, 21 days at a hotel, sightseeing tours, as well as all meals.
The food in Toulouse was out of this world. We ate like royalty.
Ryan did not pay a single dime. $7,000 worth of deductibles and copays were waived. So, with all of these goodies, what did the tribe actually save?
About $12,000.
And that's not all. 10% of the savings, $1,200, went directly into Ryan's 401k plan.
It's pretty astonishing.
And the cost savings can be anywhere from 10% to 75%.
Renee Marie Stefano is the president of the Medical Tourism Association. She says American hospitals should watch out. Employers are looking for excellent care at a lower cost, and they're finding it abroad.
Because of the increased competition, they're going to have to become more price sensitive.
As for Ryan, he's recovered ahead of schedule. His California doctor is impressed.
They did an excellent job. Yeah, just really, really excellent job.
In Blue Lake, Andrea Borba, KPIX 5.
An HR rep at a big insurance group tells us expect to see more Fortune 500 companies add medical travel like this to their benefits packages. The key to making it work, though, is to offer incentives like the tribe offered Bruce.